Hypothyroidism and hyperthyroidism. Thyroid. The gland is located near the throat. Thyroid is composed of thousands of follicles which secrete T4, levothyroxine, and T3, triiodothyronine. Thyroid increases the metabolic rate of the body, makes body quicker, controls temperature, neurological and cardiac functions. Also, it secretes calcitonin. So this is why, in contrast, PTH decreases calcitonin. Thyroid, T4. So we can diagnose whether the person has disability or is sick by looking at the TSH hormone. The normal range is from 0.4 to 4.0, but for example, this patient has higher TSH, so we can suspect the hypothyroidism in here. So thyroid and iodine. So T4 is levothyroxine, composes of 93% of total amount. It is in active form and has longer half-life, whereas T3, brand liothyronine, composes of 7% of total amount. It is active form, but short and potent. T3 molecule is involved in the thyroid hormone receptor, and when gene transcription happens, mRNA works, and synthesis of new protein happens. So thyroxine is related with growth, CNS development, cardiovascular results, such as increase in cardiac output, tissue body flow, raising heart rate, heart strength, respiration, and metabolism. So when infants have extreme hypothyroidism, which is low thyroid, the infant will have suffer from cretinism, such as in the picture. Does iodine matter? Yes, iodine is material of T3 and T4. It is in the food such as bread, eggs, salt, seafood, and milk. When iodine is low, for example, during pregnancy, thyroid hormone production is increased by 50%, so pregnant woman needs to take iodine supplement. Iodine lack can lead to cretinism in child or goiter. So when iodine is high, for example, in hyperthyroidism, iodine excess can cause resistance problem. So iodine excess can happen because of taking too much iodine-containing topical drugs, such as amiodarone or radiographic contrast agent. So let's compare between hypothyroidism and hyperthyroidism. Hypothyroidism is a lack of thyroid, so the person increases weight. There's a bad depression, extreme tiredness, memory loss, and brain fog. And the person has slow mind, swelling of the face, slow pulse rate, constipation. So these patients need levothyroxine. After taking levothyroxine for 6 months regularly, things will start coming back to life, and we have drugs such as L-troxine or Utroxig. Hyperthyroidism. The most common cause of this is autoimmune disorder called Hashimoto's disease. So think Hashimoto is slow and tired person. The thyroid antibodies from our body attacks our own thyroid gland. Literally, it is me attacking myself. Then it reduces the function and capability, most commonly targeting thyroid peroxidase. Other common causes of hypothyroidism include medicines like lithium directly interfere with thyroid hormone secretion, and drugs that contains iodine, such as amiodarone, interfere with thyroid hormone synthesis. Nivolumab or other immunomodulators medicines induce autoimmune thyroiditis, and surgery such as thyroidectomy or radioiodine treatment reduces the size of thyroid gland. So this is the picture of hypothyroidism from Wikipedia. How do we treat hypothyroidism? With T4, the levothyroxine. The half-life of levothyroxine is 1 week, so we need to wait at least 4 weeks to do TFT monitoring and recheck. Starting dose of levothyroxine is 50 to 100 microgram orally daily. We have to gradually increase by 25 to 50 in 4-week term. If we increase too quickly, then it may cause tachycardia because half-life is 1 week. Goal of therapy is returning TSH to the normal range, and T4 is not reliable, so we should diagnose this with T3, not T4. So the drug includes L-troxin and Utroxig. Let's talk about primary hypothyroidism. So there's a dysfunction of the thyroid gland by autoimmune disease or iodine deficiency. The thyroid gland is dysfunctional, so we have low production of T4. So low T4 is the reason. Then it tells hypothalamus and anterior pituitary to increase their activities. Result is the TRH is rising and TSH is also rising. So this might result in the enlarged thyroid gland, as known as goiter, because they keep wants the hypothalamus and anterior pituitary to work, so it is becoming large. And let's talk about secondary hypothyroidism. So for this, there's something wrong with the organs that are upstream. So hypothalamus and anterior pituitary, there's something wrong. So naturally, they cannot produce enough TRH and TSH. So it is not stimulating the thyroid gland at all. The T4 is low. Natural defect of TRH hormone and TSH hormone is leading to the low lack of T4. It cannot do anything. Hyperthyroidism. Let's talk about primary hyperthyroidism. So the cause is the high T4 because thyroid gland is so overactive. So it can be due to autoimmune conditions or toxic goiter. The increased T4 in blood will do negative feedback to decrease activities of hypothalamus or the anterior pituitary. So high T4 results in very low TRH and very low TSH. Secondary hyperthyroidism. Here, the anterior pituitary is overactive for some reason. It produces a large amount of TSH. The result is increased T4 levothyroxine production. Here, anterior pituitary is working independently, so the result is high TSH and high T4. Hyperthyroidism, the most common cause is autoimmune disease like Graves' disease. Grave is fast and always busy. In contrast to Hashimoto's disease, the antibodies in Graves' disease stimulate the TSH receptor to cause an increase in thyroid gland tissue, called hyperplasia. The result is increased thyroid hormone production. Graves' disease affects eyes, which looks like it's going to pop out. So another common cause is toxic goiter and toxic adenoma. Here, thyroid cell mutation results in higher hyperfunction nodules that produce increased T3 hormone and increased T4 hormone independent of external TSH effects. Goiter is condition of enlarged thyroid gland. The other causes are the drugs that has excessive iodine, for example amiodarone, or drug that has destructive thyroiditis, such as amiodarone, or too much dose of levothyroxine. So we treat hyperthyroidism by anti-thyroid drug, and first line is carbimazole. The second line is propylthiouracil. So it prevents the inactive T4 to become an active T3 in peripheral tissues. we take it 300 milligram orally daily. However, we have the side effect called agranulocytosis or jaundice or malaise. So if this happens, please stop the medicine. Yep. So agranulocytosis is the situation that bone marrow cannot produce enough white blood cell. So it mostly likely to occur in the first months of starting therapy. So if there's acute malaise fever or infection, severe pharyngitis, patients should stop immediately and do not use carbimazole or propylthiouracil in a patient who had past history. But consider the other situation to treat hyperthyroidism, such as thyroidectomy or radioiodine.